Hi everybody, I'm Dr. Bill Sterett. We're going to introduce a new concept right now called the consequence athlete. I'm going to use the example of a shoulder that dislocated. So a first-time dislocator, let's say you're 20 years old, dislocate your shoulder while rafting or kayaking. How does that affect my decision making? It's no longer just I tore something, do I need to have it fixed or do I not? It's what are my risks if it does it again? Because everything, as you know, has a risk of happening again. You may dislocate your shoulder, there may only be a 20% risk of it dislocating again or a 90% risk. Either way, what's the downside of it dislocating again? So Cortis here might dislocate his shoulder in basketball. He might rehab it, he might have a 50% chance of it coming out of joint again, but if it does, he's on a basketball court, somebody might be able to help him get it back in place, or he can get it pop back in somewhere in an emergency room. What about my kayaker who's going down Class 5 rapids? If he dislocates again, he might die. It's a big deal for these guys, the base jumpers, the big mountain skiers, the kayakers, to dislocate again. So we have to do everything we can to prevent that from happening. Even some of our arthroscopic techniques have a higher risk of redislocating than our open or incision-based techniques. So if I'm a consequence athlete, I want the lowest risk of this ever dislocating again. So think about yourself. Are you a consequence athlete? If what you like to do puts your life at risk, if this injury happens again, you need to look at yourself that way. So if you are a consequence athlete, come to me and you say, my shoulder dislocates, what are my risks? Well, if you're under age 20, it might be a 90% risk that it ever dislocates again. If you're over 40, it might only be a 10% risk that it ever dislocates again. But that 10% risk may be life-threatening. So some of our surgical techniques even might be not the best for you if you are a consequence athlete. And what I mean by that is our arthroscopic techniques are great for stabilizing this dislocating shoulder, but they may be 1 or 2 percentage points lower than an open procedure. Well, 1 or 2 percentage points may not mitigate. We'll use Cortis again for playing basketball. He says, I want an arthroscopic procedure. For the kayaker, he may say, do whatever it takes so it never pops out of joint. So we may have to decide to do an open operation, whether it's called an open Bankart or a coracoid transfer called a Latarjet, where we make sure it never pops out of joint again. We want to get you back doing what you want to do, not what I tell you you can do, and not just with the least invasive technique all the time. So least invasive is great if it gets you back reliably. If you're a consequence athlete, you need to know that about yourself and come in and say, I need to make sure this never ever happens again, because bad things will happen if it does. Anyway, I hope that helps to start the conversation a little bit anyway. I'm Dr. Bill Sterett with your Sports Medicine Minute. Thanks.